We are live and in full effect with Dr. Adrian Ross Hand. Is it Ross Hand or Hand Ross or, you know,
To my friends and to my family, it is Dr. Adrian Hand. To the medical community, I'm Dr. Adrian Ross.
okay.
So,
Okay, well then that's good. And so to me, you're Dr. Hand and
yes,
so Dr. Hand, which is a foot doctor.
and that is why I didn't do that. Yes.
Is that seriously the reason why you didn't do that? Is because of that?
No, but that was a contributing factor.
That was
My
that was
husband was
you did a
understanding of
pros
that.
and cons list. You did a pros and cons list, and
Yes,
that was one of them that you
that was
said,
one of them.
okay, that was good.
Absolutely.
It's good to know. It's good to know. Oh my goodness, I turned these off. I turned the notifications off, and it still came. Like I don't know. Listen, I've reached that age that I've given up on certain technology. So so what do medical doctors do during the COVID-19? What do foot doctors like? This COVID, it's not like a COVID-19 foot, so what do you do? Like, is all of your surgeries elective surgeries, and so have they been canceled, or how's that been working for you?
Yeah, so that's a great question. The COVID-19, because it's a virus, obviously, is affecting people, and no matter what type of physician you are, it's affecting all physicians. And if you're surgical, like myself, that really has halted all of our elective cases. Now, interestingly enough, because I'm a foot doctor, the majority of my patients are diabetics. So that means they're at risk. And so, by definition, a lot of my patients' surgeries are not elective. So I've continued to operate all my traumas, my ankle fractures, everything coming in, I'm still having to do. So, if
Okay.
anything, things have gotten a little bit busier.
Okay, so you're staying active. You're staying busy. So everybody is jumping on. They must have known that you have coming. They have come. So we have some of the usuals. Loretta, what's up, Loretta? My beautiful wife. Hello. She says hi, guys. That's how
Ah,
she says hello. Chris Harden, what's up? Sam Dula is on. Holly is watching. What's up, you guys? Hope all is well with you. Yeah, I'm here with Dr. Adrian Ross Hand, Dr. Hand, which is a foot doctor. She is on joining us today to talk about an initiative. One of the things that we talked about, and really was also inspired, that inspired me, is that I had multiple different conversations last week during the Passion Week, and one of those conversations I had was with Dr. Hand Ross, and with that conversation, she was just kind of felt this burden, this desire to be missional, to reach out and to, especially to those who are marginalized and disenfranchised. And so we're going to talk about a little bit about that today. But before we do, we always want to ask, like, your favorite ice cream. That's the best I've come up with now. What is your favorite ice cream? We want to know the human side of the doctor. Since doctors are not human, we want to know the human side of you, Dr. Ross Hand.
well, as your wife can attest, I'm actually lactose intolerant, so I'm not supposed to have ice cream. But when I do sneak, it's either Neapolitan or I like pistachio gelato. Those are the big ones for me.
Okay. Pistachio gelato. That sounds good. Like, pistachio ice cream is pretty good.
It's really good.
That's pretty
It's addicting.
tasty. Okay. I'm loving it. So, like, how often do you bite the bullet and just go with it? It's like it's worth it. I know I'm lactose intolerant, but I'm still diving
Yeah.
in.
Oh yeah, I did that the night before last. And yeah, so at least once a week, which is pretty painful. But I just do small doses, so I'm not hurting too badly.
Okay. Well, that's good. That's good. I'm glad that you're doing it in moderation. Would you consider that moderation?
No, not at all. But thank you for the encouragement.
Okay. Well, hell, if you guys didn't notice, I just looked at my screen, and if you didn't notice, like, we are looking at the beautiful new background. We are upgrading, and if I'll just get out and let you guys see it. It says Send Network, and that is, we don't have one for Blueprint, so I would throw the Blueprint one back there, but we don't have one for Blueprint, so I throw the Send Network one. Blueprint Church is a part of Send Network, and for those of you who don't know, I am the vice president of the Send Network. And so they give me kind of toys like this and backgrounds like this all often. And so actually today at 4 p.m. We're doing a call for like pastors all across North America, and we're going to be doing a call list of talking about how we can engage better and things that we're doing as pastors. And actually, today's topic will be something that I will be encouraging pastors about: how do we minister to the poor and to the marginalized and those who have been adversely affected or because of the COVID-19. And so I'm excited. So I'm kind of doing the pre-setup, the pre-backdrop, and so you guys get first look. Blueprint Church always gets first look at kind of what's going on here. So we're about to kind of get into the topic. It's now 11:05. I usually spend the first 5 minutes just kind of talking again. Blueprintchurch.org /give if you want to give during this season. And if you know there's a way to give above and beyond. And then also blueprintchurch.org /prayer if you want some specific prayer. Thank you guys who have been sending your prayers. We are praying for you, and we're looking forward to praying. So the more that you guys are sending them, the more you guys are able to be lifted up by our Titus 2 women and our shepherding elders. And so just continue to send those to us. And if you have been adversely affected and covenant member of our church, finance at blueprintchurch.org. All right. So we are going to get started. Dr. Adrianne Hand Ross, who's a foot doctor. God has put a burden on your heart. I don't know if it was last week or when exactly it was, but he put this burden on your heart. What was that burden?
Yeah, so as you know, I blew up your phone and a couple other people's phones. I had a conversation with a couple of friends of mine, and it was kind of coming up on the news a lot more than typical that COVID-19 was affecting the African-American population as well as low income specifically. So, I think one of the articles that I looked at was in Chicago. There was like a 70% of the cases of infections and mortality were African-Americans. And so I kind of sat and chewed on that for a little while and got into a lot of conversations with people, and I'm action prone and just thought, man, we've got a large network of people. And then ironically, my church sits at the epicenter of the old Fourth Ward, and there's not 1 or 2 days out of the week that I typically would go to church and see, my brothers and sisters. So I noticed also I was on my way to surgery, and one of the nurses that was kind of hanging out in the area, I was telling her I was kind of venting about, like, we need to do something. And she said, you know what, if you do something, I'm behind you. And then 6 other nurses came up behind her and said, hey, we need to do something. And then I went to another hospital the same day, and I had to operate. And those nurses, I was venting again there. And it hadn't taken form quite yet as to what exactly we were going to do or what they wanted to be done. But long story short, that's kind of the genesis of where this came from.
Yeah, it is interesting just kind of even to see the evolution. Like there was literally legit like rumors going around that black people can't get, the COVID-19 that was going on,
Yep.
all the way to go from one pendulum swing to the other pendulum swing. And I know that the general surgeon, who's come out and said it's not specifically black people. It's not like we got a certain trait or gene. It's not similar to like sickle cell or, some of the other, but we recognize that because it's oftentimes that black people are living in marginalized and poor areas, less access to certain resources, that we have become more adversely affected, and we're just not educated about that. Like, talk about just kind of that pendulum swing when you started hearing about some of that data, how that hit you.
Yeah, so it's interesting. When I went to my office one day, I had that came in, and the majority of my patients are diabetics. 7 of my diabetics came in, and they didn't come in with a mask. And I said, hey, is there a reason why you're not wearing a mask? And he said, well, doc, I'm not immunocompromised. I'm not sick. And I said, well, honey, you're a diabetic. Yeah, but I'm taking my medicine. And I thought, okay, there's a significant lack of education here that needs to be done on our part. So that was one of the aspects. And then the other thing that you bring up is there are a lot of rumors going around all the way from, I've heard from, yes, African-American people cannot get COVID-19. I mean, legitimately, I had educated professors that were patients telling me this, all the way to now when you're seeing the data that Yes, and it's actually hitting us harder. The interesting part about it, and that you touched on, is it's not like it's a genetic trait or anything to that effect. It's actually more related to socioeconomic situations. So if you notice, Black people tend to be the ones more marginalized. What does that mean? That means that access to health care. A lot of these recommendations that are being done by the CDC and the World Health Organization are almost being done in light of you already having a family medicine doctor. And not everybody does, and not everybody has insurance. And they will say free COVID-19 testing, but there's a lot of people who can't get it, and it's not widely accessible. So that's kind of dispelling the rumors, what's out there.
Yeah.
That answers your.
No, that's great. And so, we're talking about doing this in the fourth ward as kind of a pilot place, and and our goal is that that we can use this as a model and an example for other places to doing, other churches and other leaders to kind of take some of the initiative for that. Let's just talk about this, real quick. Like when you think about what are some of the overarching goals that you have for this initiative. You call this initiative My Brother's Keepers Initiative. My Brother's Keeper Initiative. Why My Brother Keeper Initiative? And then talk about it a little bit, the overall goals. So first talk about what it is, and then what are the goals of it?
Okay. So the My Brother's Keeper Initiative basically takes grounds from the idea that, for instance, we just got through Easter, and we were talking about it on the phone, that this is very much kind of the birth of the believer. We were resurrected, and what does that mean? That we are going out and we are taking accountability and responsibility for our siblings, and for us to do that and flesh it out, that's where this My Brother's Keeper Initiative looks like. For us to be able to take what others cannot reach in their own good resources to them, if we have to physically take it to them. So the My Brother's Keeper Initiative is saying the pilot is going to be in the old fourth ward. And what we're trying to do, and what we will do, is that we are going to launch a testing drive, a COVID-19 testing drive. We are aiming from anywhere from 100 to 300 free tests to be done, regardless of whether you have insurance or you don't have insurance. That this will actually be done at Blueprint Church at the Old Fourth Ward. So that's one, is the testing drive. At the testing drive, we will provide tangible needs such as food, or toiletries, whatever we can give specifically in packages to last a family of about 5 or less up to a week. And why are we doing that? Is to prohibit them from going necessarily to, or discourage them from going to grocery stores where it's pretty common, where you come encounter with somebody in actually large crowds, where you're more likely to contract the virus. And then third, if you notice, at least the medical community notices, that there's not a lot of data out there right now with respect to the African American population and how it's being affected by COVID-19. What we're looking to do is we're going to take the data and the variables that we get from this drive and report that so that we can get resources ultimately and reproduce what we do at Blueprint Church at other churches. Yeah. So those are the main goals.
Okay, that's good. And so let's look at some of those, like those overarching goals, and so talk to me a little bit about the importance of testing sites, right? The importance of providing these testing sites, of just knowing that you have it. Like what are the benefits of providing a testing site?
Absolutely. So good question. Why should we even test? Because in fact, if you get tested, let's say you have these symptoms, there are a lot of people out there who don't have symptoms and they can still be COVID-19 positive. What does that mean? That means that if you are asymptomatic, you can be spreading it, and you can spread it to somebody who ultimately can be hospitalized and potentially could die from it. So that's one. And we can't get an assessment as to how bad this is if we're not testing people. So we're basically operating blind. Johns Hopkins has a dashboard that basically shows how many people have been infected and how many deaths. But the problem is you won't know unless you actually test them. And we won't know how much it's affecting our community unless we take the test directly to that area. And the reason why that's so important, to kind of answer your question, is if we're not testing people and they don't have visibility of it, then they don't know, oh, I really do need to protect myself. So people you see walking around that aren't wearing a mask, we're hoping that will be more inclined to wear a mask when they start to see that, oh my goodness, there's about 40 people in my area that are positive. I have asthma. And now that I've been educated on it, I know. And now we're creating almost like a contagious spread of this knowledge as well as the need for the test.
So, well, what if some of those people who are like, hey, isn't that going to provide opportunity for spreading it even more if we're testing people? Like, what are precautions? What are things that we're taking as we're talking about doing this testing, creating a testing site? What's going to keep that from testing, spreading the virus even more?
Absolutely. So, as a healthcare worker, we go into the hospital every single day. We're considered the frontliners right now, and we risk our lives and we put ourselves at risk. And we're using only healthcare workers, particularly who will be administering the test, physicians, nurses that thankfully some are of the Blueprint family that are going to be volunteering to do this. That's one. So, we have people who are used to dealing with it. Number two is we are providing personal protective equipment. I've had a couple of family members from overseas that have been shipping in masks, N95s. Everybody will get the appropriate protective equipment that they need. Mm-hmm. And then also, we are not doing any paper pamphlets. There's no paperwork going back and forth. Everything will be done via electronic on a survey with an iPad. People that will be driving up in their cars will be asked to hold up their IDs so that we can take a picture of it. But there's no a lot of handing back and forth. So exactly, no touching. And the reason why we're doing this, and I guess we have a template because I like to see that something's been done effectively once before. They did something similar like this down in Columbus, Georgia, as well as in Birmingham, Alabama, as well as in Clarkston. And I've been in network with a lot of those different communities, seeing exactly how did they take the precautions, and we're reproducing a lot of that.
Yeah. So, okay, so one of the things that you also talked on is just the education of people. What are some ways that we're going to be using this platform as a way of educating and informing people about kind of the impact of COVID-19 and some of the things that they may not know, especially for some of the communities who may not have cable and some,
Sure.
in some of the news outlets?
Absolutely. So for one, we're creating a network. We're using Blueprint as a network because it sits right in the community and it is of the community. So most people don't have, maybe they may not have laptops, but they do have cell phones. If you notice, almost everyone has a cell phone. So we are actually in the process right now of launching a website or a landing page that'll be mobile friendly, where people can actually go on and have a resource that if they have symptoms, that it gives them the actual tools of who to contact. And basically, that's what we're doing. The drive is creating a network of physicians and healthcare workers who can function almost like that family medicine doctor that would be triaging you before you would necessarily have to run to the hospitals.
Okay, no, that's great. So being able to create a place where you can get tested so that are actually trying to decrease the spread and inform you, because if you may be asymptomatic about that, I think that that's critical. But also we're going to help educate you, in there by doing those things. And the third one you talked about is providing a meal, providing resources and a meal for them, and and you said that the reason why is so that they don't have to go to the stores and those types of things. But what's also I think is also as important for us is that a lot of, especially in these poor and marginalized homes, is that the no longer being in school is, for many people was the daily nourishment that some of these children were having. And so being able to provide meals also creates an opportunity for those who may not be able to, afford or, have access to those types of meals. So I think that's another important thing. So you've launched this. It's My Brother's Keeper Initiative. I'm here with Dr. Adrianne Ross, who's a foot doctor. She is, launched this My Brother's Keeper initiative. How do people find out about this? How do we get involved? Specifically Blueprint Church. Like, man, this is my church. I would love to do this. I want to be involved in something like this. Like, how can I get involved? How can I give? What are some ways to get connected?
Absolutely. So we'll be posting it on the Blueprint Facebook page. There's a Gofundme right now, and I want to specify that if you're not, because these are times where a lot of people have been financially hurt, this is not necessarily you have to donate financially, but if you can partner with us in other ways in your talents, that's actually very helpful as well. I can give you my email address. It's drdr.ross@gmail.com if you want to email me for questions specifically. The other aspect of it is the GoFundMe page that we have. If you were to look up My Brother's Keeper initiative and type that in, the page will pop up. We're currently trying to raise $30,000. The $30,000, because I know many people have questions about, is specifically targeted at purchasing tests, and any overflow will go towards tests and the protective equipment, as well as the food for everyone. So that is probably the best way, but if you do have a question, you can email me.
Yeah, and that's good. And so how are we getting the word out?
So right now, I'll be honest with you, I've been making a lot of phone calls and person to person. You know, if you can pick up the phone and call 5 people, especially of the Blueprint family, and let them know this is what we're trying to do for our community, and this is not just a African American thing. This is actually an American thing. This is, everybody needs to be involved. A lot of people that I've reached out to and that have donated, we've reached $4,000 already, and that's not even including what Blueprint has contributed. I'll be honest with you, a lot of them are not even from Georgia, but they felt so compelled to do this. So I would say that word of mouth is a big one right now, or calling people by phone. If you can spread it on your Facebook pages or your social media, that would be great.
So what's
Absolutely.
the goal? What's the goal and cost in terms of how much are we trying to raise?
$30,000.
30,000. And what's that $30,000 going to?
So the $30,000 is going to go towards the actual COVID-19 tests. The tests are going to be a rapid turnaround, so 48 hours. The standard is 5 to 7 days for results. We specifically are purchasing the 48 hours because it's more realistic for people to get results that quick. The other amount of money is actually going towards the personal protective equipment for the volunteers, the physicians, and the nurses that will be doing this testing in 2 weeks over those 3 days.
Okay.
And then the meals. Excuse me.
Okay. So it's not going to you and Brian's date nights?
No, not at all.
No date nights for you guys. This is
No.
This is all
Well,
okay.
it's at home now.
Yeah, that's good. So they've asked the confirmation of your email is Doc Ross, DRROSS at
So it's
Gmail.
right. So it's DR period RO S as in Sam at gmail.com.
All right. So Dr. period Ross at gmail.com.
Exactly.
All right. So yeah, and so like in terms of letting the neighbors, Angie's asking how would the neighbors know? And one of the things that we're doing here in the Fourth Ward is that we're mobilizing our city groups and city group leaders, and and something that we're trying to do is this, to getting the word out to some of the people that we've already come into contact with, where we have emails and names, because we want the right people tested, right? We want to those that don't have access to, like you said, some of the healthcare physicians. Like for Angie, like there was a period of time it was just like, man, like one of our kids were coughing and then like, but we have, the beautiful thing is that we have people like you and Hernan and Sandy and, even our own physicians that we can call that a lot of people don't have access to, and we worked through that with our doctors, like whether should we bring her in, not, and after talking, no, we didn't need to bring her in, but people don't have that access. And so so we want to make sure that those people who don't, as much as we can, who don't have access to that type of relationships, and those relationships are doctors, to get that in front of them, and I think that that's really something that's critical. And so us, we're going to make sure that we maintain safety and, and all of that. We're not spreading, but we're going to be doing different things to remind us, to allow getting the right people out to do the drive-bys and the walk-bys. For those who don't have cars, are they just going to walk by, or like how does that work?
Right. We're going to have a walk-up tent, and we're going to have a barrier as well. So we're going to have so many personnel. I mean, anywhere from 8 to 10 volunteers, not including the actual nurses and physicians that'll be on site, so that we're able to manage it. And we're going to break it up into 3 days. I will tell you honestly that a lot of it is being modeled after what's already been successful at other sites. So we're not reinventing the wheel. We're just trying to take it to a new community that hasn't been reached yet. So a lot of this has already been tried and tested.
Okay, that's good. So ultimately, there's a few questions out there. So what are some questions that you guys have for Dr. Adrianne Ross Han, who's a foot doctor, to ask, questions you guys may have for her on here. So again, we put on the link, My Brother's Keepers Initiative, to learn more about how you can help specifically and everything. Do we have a specific date? Are we doing this on the weekend? We doing it on the weekday? I know you say 2 weeks,
Yes.
but like, what's the date?
Yeah, so it's April 24th, 25th, and 26th. It's Friday, Saturday, and Sunday. We're going to be doing it in the evening, so from 1 to 5 p.m. on all of those days. The volunteers will gather at 12 noon, and then we'll go ahead and we'll have everything set up for people to actually open sites, 1 to 5.
1 to 5. I'm glad you're not interrupting my 11 o'clock, time.
No.
This, because, you don't want to compete with me. I got millions. Following me
not.
right now. And it's just
Not.
like, whew, that would just throw all types of wrinkles in things. So it says, how do we make sure that the right people are tested and it's not just folks who hear about it and come, but have access otherwise?
Yes, so kind of getting to Angie's question. We've already reached out to specific neighborhoods embedded in the Old Fourth Ward community where have a substantial number of families. We're waiting to hear back from them and we honestly approached them first rather than any other community. I know other testing sites have done zip code only, but as soon as you open it up, as you can imagine, people from all over come. So what we're doing is intentional marketing and targeted marketing towards those communities so they know exactly when to come. The only concern I had was if we were to do appointment scheduling, that if someone misses an appointment, we're not going to turn them away. So we're being intentional about that, about the marketing.
Yeah, you get it. And there's some targeted people here in the Fourth Ward that have connections with people in the neighborhood, and so that's really what we're again, like you said, some targeted marketing where we're going in and focusing in on these people. So it's the weekend of April 24th to the 26th from 1 p.m. to 5 p.m. We're going to be doing that, and so I'm really excited about this. Jennifer is asking, Scott asked, is there a flyer? Are we going to create a flyer for this, or is this going to be?
Yes.
Okay.
Yes.
And how do we get to that flyer?
Yes, so I will forward you everything that we have so far. We're launching a website as well as the flyer and all of the paperwork. Right now, I think the biggest thing that I need is if anyone is interested in volunteering and helping, please email me. That's going to be the big thing right now.
And then what type of volunteers are you looking for? Not people who have certain,
Exactly. Thank you for saying that. So we are looking for volunteers that are going to be on the site that please, if you have been COVID-19 positive, please don't volunteer for the actual on-site work for obvious reasons. If you have diabetes, lung disease, including asthma, any of those risk factors, and I can specify more, that I really would not want anybody who's already compromised to necessarily be on site. But there are two types of volunteers. There are the ones that are going to be on site, and then there are the ones that are going to be behind the scenes, because we're going to be following up and giving test results. We're going to be following up and checking in on people and seeing how they're doing, because that's part of the initiative, is creating a network so that we can touch these families.
Yeah. Well, that's exciting. I'm really excited for it. One of the things that I'm also excited for as a pastor, and if you're a pastor in your neighborhood or pastor in a community all across the country and you're listening to this, one of the things I'm excited about for us is to mobilize our people to being able to connect with them in the neighborhood, right? What gets me excited, when you look at churches in the old days, if you look at universities, when you look at hospitals, most of them, like they're Baptist hospitals, there's Presbyterian hospitals, their hospitals and universities were all founded by churches. It was churches, most hospitals, churches were founded by a collection of Baptist churches getting together and saying, hey, there's a need, a social need in this community. Let's get together and let's start something. And then a hospital will come up, And so when we talk about meeting the needs spiritually, emotionally, economically, and socially, that we are being able to meet holistic. And when we get a chance to show how much we care for them, their health and just their total well-being, then we can present to them a God that cares for them holistically. And so I'm just really excited about the opportunities and the relationships. So being able to have this targeted in an area in a neighborhood in which I live in is really going to be exciting, and being able to mobilize a lot of the city groups that are in this area that are willing to kind of be and to be able to connect and to build on the relationships that have already been started in the neighborhood, and even to build some new relationships that we have not had. And so it's really getting me, excited for us to be able to do this in a real way where we can still decrease the spread of the corona, but also increase our ability to be neighborly. And Dr. Adrianne Ross, who is a foot doctor, is giving us that opportunity for us to do that. And I'm really, really excited for us as a church. And these are some of the ways, like I told you guys, that we're going to be getting out there. We're going to be out sharing, but we're going to still maintain our safety. We're going to stay within the government, the laws of the land and all those things. But at the same time, we're going to learn how to be better neighborly, to our people. And so I'm really, really excited about that. I'm excited about just like Adrianne, you just mobilizing everybody, and just having the desire to do this. And I really do hope that this would be a catalyst to seeing other churches and other people doing this across the country. So,
if I can reiterate, Dhati, when I had the conversation with you on the phone, I know the part that got most exciting was when we said that if we do this and this takes form here at Blueprint Church, this will be a blueprint or a template for other churches to be able to take the healthcare workers they have or others in their community and do the same thing with the same precautions. Because COVID-19, I don't believe is necessarily going to go away randomly. I think we're going to have to fight back, but we'll have to do it together.
Amen. Amen. And so, again, it's called My Brother's Keeper Initiative with Dr. Adrianne Ross, and we're talking about on April the 24th?
24th
through the 26th. 24th to the 26th, we are doing, we're going to be launching a COVID-19 testing site. We're going to be providing meals during this time, and then we're going to be educating members in the community of the risk of the at-risk health conditions during this time. I'm really excited. There's going to be some triage patients based upon the symptoms, and then we're just trying to create a network, to follow up for data, for reporting, and all of these things. And so I'm really excited that Blueprint that we're taking this step, right, to also taking the step to proclaim the gospel, And so you guys, I don't say this often, but I will say this today. Like, this is the type of stuff that we want to make sure that you are sending this to your friends. Like, share this post with your friends and let people know what we're doing in our church, for the sake of donating to the My Brother's Keepers initiative, for the sake of just getting the word out, because this is just one of the practical ways that we can take initiative for the benefit of others. And I'm just really excited for the My Brother's Keeper initiative. This is something that we're championing, something that we're going all in on. And so we just really want you guys to embrace that. Pray for those times. Pray for that we would raise all $30,000, and then and pray ultimately that that we can help people either avoid or overcome any sickness that COVID-19. But ultimately, let's even pray that even something greater, that because of us being concerned about that need, that we can overcome an even greater sickness, and that's sickness, and giving them the ultimate remedy of the person and work of our Lord and Savior Jesus Christ, and that some of these people will come to a saving knowledge of our Lord and our Savior because of our genuine concern for their health. And so we appreciate you, Dr. Adrianne, and we just really thank you for being obedient to God's kind of compelling you in this way.
Definitely. And I'd like to say thank you to Blueprint. If the members do not know, Blueprint actually donated enough to cross us over $10,000. So just recently. So.
Yeah. Well, we're grateful to be a part of this and grateful for everybody. So you guys, again, the link is in here. Share this with your friends. Let people know. And just let people know about this. Like, so share this link, share this, that they can get a better understanding of what we're doing with the My Brother's Keeper initiative. And we want the word to get out. Share with people in your city groups, share it with everybody that you know, because we want this to be. And so we're going to be doing this in the parking lot here at Blueprint Church on April 24th to the 26th from 1 p.m. to 5 p.m. And so we're just really excited. But on a final note, before I let you guys go. This week, every household, if you are a household at Blueprint Church, remember we've been looking at Acts chapters 17, Acts chapter 17. So we'll be reading that. Tomorrow we'll be with Pastor Lucius and kind of going there. But also, we've been memorizing weekly. Last week we memorized Isaiah 40, 28 through 31. This week we're memorizing Jeremiah 17, 5 through 8. Jeremiah 17, 5 through 8. And in that, we're asking families, you can, if you have roommates, family, members of Blueprint Church, put together a video with you memorizing the verse, putting together a dance, make it fun, interactive that you're doing with your family, and in that, share that with us. And then we're gonna give a prize for those people. What we're trying to do is that we want to encourage you guys to memorize the scripture in a fun way with your family. So you, Brian, Caleb, you guys get a chance to do that and memorize the verse. It's Jeremiah 17, 5 through 8. And if you are a Blueprint family member, do that, memorize it, and there will be a prize. We will give you a prize for the most innovative, creative family that puts that together. And again, it doesn't mean you have to have children. You can do it if it's just a couple, if it's just roommates in a house. Put it together. Let's be creative. Let's dance. So this is the Christian version of TikTok. We're going to do our version of TikTok through memorization and verses. Jeremiah 17, 5 through 8. So you guys, I'm really excited about that. And so more information to come out around that. So basically, fam, we love you. We appreciate you. And again, we're always upgrading here. We're upgrading our guests every year. We got Sin Network in the background. We're doing this thing, y'all. So we're excited about what God is doing. So thanks, Adrian. We appreciate you.